Welcome back to Benchmark. Sri Lanka has one of the leading healthcare systems among developing countries according to the World Bank, which acknowledges that over the years the country has made major gains in maternal and child health services. And with the end of the armed conflict and the rise in tourist numbers, there is talk of promoting medical tourism in Sri Lanka. Indeed, both the government and health sector leaders strongly believe that the island should be positioned as a regional healthcare hub. So what are our strengths? What is our USP and what must we do to become a healthcare hub? Lakith Peris, Chief Executive Officer of Lanka Hospitals, offers his views on this and other issues facing the healthcare sector in Sri Lanka today in this exclusive interview with Savitri Rodrigo.
Good to have you on Benchmark. Welcome, Lakith. What is the health of our healthcare sector these days?
Well, it's like this. The healthcare sector has been rapidly growing. It has been growing for some time and it will continue to grow. And the growth is driven by a multitude of factors. So, am I to explain? So, if we say that, like I told you, it's due to multitude of factors that the health sector would grow. Especially few things like the changing disease patterns, the shift in demographics, lifestyle changes and so on, and also environment changes will continue to have a growth in the industry.
Well, both the government and sector leaders like yourselves strongly believe that Sri Lanka has what it takes to become a healthcare tourism hub. So what are our strengths? What are the USPs that we have, and when do you think we can realize this dream?
As you know that the health tourism is growing rapidly, and it's very common to see that people flying across borders in search of quality medical care. And in the past, if I'm to just give you an explanation, in the past we saw a lot of Asians, the rich Asians from the developing countries going to the Western world in seeking quality medical care. But of course this has changed now. We see more Westerners coming towards Asia in search of quality wellness and healthcare products. And in this scenario, if you take Sri Lanka, Sri Lanka is now geared to position Sri Lanka as an emerging healthcare hub. And we have great facilities, we have great infrastructure, we have doctors who are best, can be compared to the best in the world. But of course we do have our own issues which we need to focus upon.
How about our infrastructure, Lakith? We are talking about world-class facilities and, world-class hospitals, tourism hub, etc. Do you think that people, your high-end healthcare tourists who want to come here, would be happy with our roads, with our, the status of our public transport, in general, our infrastructure? Even though we have the technology and the expertise to work with, would they be getting into a tuk-tuk to go from place to place or waiting 3 hours for a call-up cab?
One thing that I can assure you is that at the pace that this government is working at present, the infrastructure development that is taking place at present, I think that's there's a lot of positives in it. And in the future we can see a lot of development in these areas like the roads and the transportation, for example. And with this, for example, for the private investors to go and invest in outstation areas would also be something that we will have to evaluate closely, because from here to Galle it will be just 40 minutes after the highways are being done. But in order to tackle this issue right now, it is important that the sector, the health sector, when they give their services to the international clientele, they need to give a seamless and a total solution. For example, our work should start at the time that the patient is there, and from booking of hotels, picking up from the airport. We need to do that for the moment, and once the infrastructure develops, I think Sri Lanka has a lot in tourism to offer.
So you said that Lanka Hospitals is a semi-government owned hospital. Nevertheless, your ownership has a majority owned by the state. What has changed from an operational perspective from the time the management changed from Apollo to the new management?
I think a lot has changed. For example, the ownership change came into being in 2009. I think with the vision and the direction of our chairman, Mr. Gotabaya Rajapaksa, a lot has changed where Lanka Hospitals is concerned. We first took this bold initiative of changing our brand name or rebranding Apollo as Lanka Hospitals, and since then the organization has grown, and it has also, I mean, in 2010 we ended up as the most profitable the city hospital, and also we have done a little bit in keeping the escalating prices, escalating tariffs in the private sector by focusing on an affordable pricing model. Our technology has changed. We have acquired new technology, and right now we could say that Lanka Hospitals is a formidable force, and also in many things we lead this aspect, but of course we work very closely with the entire hospital sector. The major hospitals, the major 5 hospitals work together in all the decision making that we do.
How do you respond to critics who say that service standards have dropped since this change of management and ownership compared to what was there earlier, even though the competencies and the expertise remain the same?
I don't really agree with that. Since taking over, there are few things that we have been focusing a lot, and one thing is to achieve operational and service excellence, and this is the only way that our hospital sector, in fact the entire sector, can shift from where we are to the next level, so that we can create a new market space. And Lanka Hospitals is concerned, we are focused in this. Our focus is that we want to provide a different experience, a positive experience to all people who walk into our premises, a positive experience that they have never experienced in the hospital sector before. And our primary focus is on 2 things, processes and people. And we have been focusing on this since 2009. For example, if I tell you about the training and the development, how focused we are, in 2011 up to now, we have achieved almost 20,000 man hours and about 2,000 man days in training and development, and that is, compared to any sector, it's a lot of training that is going in. The feedback tells us that we have improved a lot in terms of our service delivery, and what we need to do is to maintain the consistency, and we are very passionate about that, because we are now focused in the international business. And for us to be successful and for our industry to be successful, it's mandatory that we achieve service and operational excellence.
We now take a break for some messages from our sponsors. When we return, Lakit Peiris tackles issues such as the competitiveness of the healthcare sector, especially in terms of pricing and rates, the preference among many locals to seek specialist treatment in Chennai and Singapore, and the difficulties faced by rural folk in accessing quality healthcare. Thanks for staying with us. We now have more excerpts from our exclusive interview with Lakit Peiris.
In terms of rates and pricing, how competitive is the healthcare sector these days?
Well, the healthcare industry is very competitive, and once again the major players are all clustered in Colombo, and there is a lot of technological advancements, and I think it's healthy competition. And because of this competition, all the major players are striving towards being better in terms of their service delivery, being better in terms of their operational excellence, trying to be better in terms of introducing and acquiring new technology, and also being competitive in their tariffs. So I think it's very, very good for the people, for this industry to be competitive. But at the same time, what we have seen in the private sector is that we see that the prices are escalating, and fewer and fewer people can afford private health care.
Well, there are city people who, for the most part, get their treatment in either Chennai or Singapore. Now, how can we expect health tourism to flourish when our very own are going abroad for treatment?
Once again, this is an area that we need to tackle efficiently. We need to see why the rich in Sri Lanka travel across borders in getting medical. Is it because we don't have the quality? Is it because our service levels are not as good as what they expect? So in my view, what happens is that few things that the industry needs to focus is that, like I told earlier, service and operational. Both these things we need to excel. And also we need to excel in terms of our doctors. Like I said earlier, Sri Lanka, we have a wonderful mix of quality consultants or quality specialist doctors. But unfortunately, we don't have enough doctors to join our system on full-time basis, because most of the doctors that we have are attached to the government sector, and they function as visiting consultants to the private establishments, and they come in the evening, which brings a lot of inconvenience to the segment that you're talking about. But when our people, the rich who can afford, they go to Singapore, I mean, they can meet whoever their doctors 24 hours, right around the clock. There is a seamless service, no breakage of service at any point. So this is where we need to strive. And in order to do this, we also need a lot of support from different stakeholders.
How about the less fortunate amongst us? You were talking about the focus being on the state sector, being accessibility to healthcare rather than actually imparting the more qualitative aspects of it. However, it still remains that in the rural villages, people have to travel very far, come in at 3 a.m. in the morning to get their consultants channeled, and it is a very hard life. And even though it is free, the state sector imparts free healthcare, tests, etc., have to be paid for. When are we going to have a country where all Sri Lankans will have equal access to healthcare?
One thing is, if you're talking about the rural, out of Colombo areas, and the access to healthcare in these areas, especially by the people who cannot afford private medical healthcare, I think we need to congratulate the government sector healthcare system. Not only this government, but all governments have been focusing a lot on free healthcare. And I can tell you without any fear that in Sri Lanka we have one of the best free healthcare systems in the world, which is everything is free. And sometimes what happens is that when things are free, people don't appreciate it as well. And we have a chain of hospitals in the government sector, and I think there is reasonable access to healthcare. And also the government sector is now starting to focus a lot on the quality aspect as well. For example, I think last year we saw that a hospital in Ampare won the National Quality Award, so which means that the state sector is focusing on this quality aspect. But I believe that for the rural areas, there are district hospitals, there are base hospitals, but sometimes probably the lacking things would be certain major specialities not being available to them.
Let's move on to an epidemic that has been plaguing our country from time to time, dengue. Lakit, are the authorities doing enough to contain the spread, to create awareness? Are they doing enough? And also, are the people doing enough? And the other stakeholder, the private sector, are you doing enough? CSR-wise, maybe awareness and even actual proactive work to contain the spread of dengue?
Well, what I see is that there is a lot being done right now, and I don't know whether it's enough or not, but I know for sure that the government is focused a lot in eradicating dengue. But this is something that the government of Sri Lanka cannot do on its own. Like you said, the public has to support towards that. We need to understand that this is something that all of us have to work together as one team. So in my view, that the government is doing their bit to eradicate dengue from the country.
Well, I know you have your own challenges in the healthcare sector, but where do you see Sri Lanka's healthcare sector in 10 years maybe from now? And maybe you can do a SWOT analysis of what it is like.
The health sector will continue to grow, and in 10 years from now, Sri Lanka is going to be on par with the best international models. I can tell you that bit. And where the technology is concerned, we will definitely have the best of technology. even right now, our technology is quite comparable to the Western world or the rest of the neighboring countries. There are new procedures coming in. People have more expectation. People know their rights. No longer are the patients at the mercy of doctors or the hospitals. They know exactly what they want. They know what their expectations are. And also they know whether we fulfill their expectations or not. In my view, the healthcare infrastructure is going to develop. You will see healthcare getting into a totally new market space in time to come, and the healthcare delivery will be so good. I can see this happening because of the planned investments that we have, the sector have in mind, and I believe that Sri Lanka will definitely be one of the emerging, or I could say one of the healthcare hubs in Asia, along with countries like Singapore, Thailand, India and Malaysia.
That was Lakith Peiris of Lanka Hospitals. Time now for a commercial break, and when we come back, we bring you excerpts from LMB TV. Stay with us.